One thing I'll say is if Medicaid is cut, I won't be affected because I wouldn't be able to be attend my appointments, medications, and all my doctor's appointments. So Medicaid, we have to save for our insurance to pay for the prescriptions that we take. I know one of the prescriptions I take is like $1,500.
I have sleep apnea, and the machine itself is like 1,000, and plus it's equipment. So if I don't have that, then you know, if they cut the health care, I can't afford the machine.
A lot of women are going to be affected with the loss of the ACA. We're going to lose our cancer screenings, and women will not be able to be. Right now, women cannot be charged a higher insurance rate with the ACA.
You can also lose maternity coverage,
Yes.
cost-free contraception.
Yes. Oh, yes, that pre-existing condition, pregnancy.
What women will lose?
A lot of things.
Okay, I'll go. Cancer screenings such as pap testing and preventative medications for breast cancer or cervical cancer, skin and lung cancer, pregnancy. Some insurers do actually consider pregnancy a pre-existing condition, and I actually think I can't remember the name of the woman who I can't remember. One of the Trump admin health-related appointments was saying that maternity care could be excluded from insurance coverage. Also, currently through the ACA, contraceptions are covered, so they're cost-free, so there's no copay. If the copay could come back on that. And some women cannot be charged a higher insurance premium just because, unfortunately, they're women. And my voice is really going, so I'm going to stop it there. But there's a lot of things. And anyone's looking just about women's care, our Senator Jill Brand gave a really impassioned speech on the Senate floor when she put up an amendment when the Senate several weeks ago was talking, when it first entertained about repealing Obamacare. And she gives a really wonderful, it's about a 5-minute speech. If you just Google it, but it's also on her page on the Senate.gov site. It's a really wonderful speech, and it just talks about what women can lose. We made a lot of gains under Obamacare, and if it was repealed without an adequate replacement, which is what they're kind of talking about now because they're afraid that Republicans will get cold feet, and they may just yank it. Women will lose a lot of the hard-won gains that we made through Obamacare. And I'm going to quiet now. Oh, I'm Julie Weisberg. I'm the Director of Public Communications for Family Planning of South Central New York.
They're going to be eliminating copays for preventative services. They're going to lose providing an annual wellness visit, reducing drug costs by closing the coverage gap, the donut hole. Since 2010, it's saved an average of almost $2,300 per person on prescription drugs, and supporting home and community-based services as an alternative to nursing home care. There's a lot of work being done right now, and the New York State Senior group is working on it, and that's getting more home care for people so that they don't have to be put into nursing homes. And that, of course, will go away quickly.
Or even in institutions too. And I just recently left the institution 2 years ago. My Medicaid and Medicare helped pay for my visit.
Thank you.
So that support would go too.
Okay, anyone else before we move on to?
Just a second. Hi, my name is Joan Giesick, and I just want to understand. They want to take away contraceptive. increase the cost. They want to take away coverage for maternity,
Yes,
and they want to make abortions illegal.
right.
Yeah, makes sense.
They're right.
My name is George Moulton, and I'm just looking at some things like the number of people that are at risk of losing their coverage. You've got 20,000 individuals on this one sheet here. Basically, they don't have any coverage. What do? They end up going to the emergency rooms. Our emergency rooms are already overloaded with people. It's better for them to go to a primary care physician and get coverage there. We're also facing a very serious epidemic, opiate situation right now, and my understanding is that there are a lot of people that are being helped during this crisis situation where one of the members of the family has an addiction, and this is also going to be impacted by this. So there's a lot of hidden things that we don't see. We see individual things amongst people, and it's very saddening to hear that, but as a community, there are significant things that are going to happen once this Affordable Care Act is taken away.
Thank you.
Thank you.
Under the issues of mental health services and substance abuse related issues, coverage for mental health and addiction treatment must be as complete as it is for any other medical procedure. Addiction evaluation, addiction treatment medication, family counseling, and anti-craving medication are all listed under those services.
Yeah, I'm not sure if you've talked about part-time and temporary workers. I'm the president of Substitutes United in Broome, which represents substitute teachers in 6 school districts in the area. And for many years, closer, okay. Okay. So the thing is that for many, we have been able to get significant wage increases for substitutes. We were never able to get health insurance for substitute teachers. And but now that the Affordable Care Act has been in place, substitute teachers can get quality, affordable health care. Now, some of our subs come from all different economic backgrounds, so there are some who actually are retired. Well, retired teachers already have health insurance, but some have fairly affluent spouses. So for them, for a few of them, health insurance has actually become more expensive because of the Affordable Care Act. But for a lot of subs, it's the first time they've ever had health insurance, and it's also very affordable. The Essential Plan, particularly, is extremely affordable and very good quality health insurance.
Thank you.
Hi, I'm Joshua. I was working full-time. I worked full-time for corporations and nonprofits, and I always wanted to be an entrepreneur. And one of the things that was keeping me from doing that was, inability to get affordable health care. Because of the Affordable Care Act, I was able to leave my job in a nonprofit, start a business. We created Luma Production Arts Festival, which brought 30,000 people to downtown Binghamton. Working on an aspect. I don't say that to pat myself on the back so much as to say, for a group of people that's supposed to be pro-business and pro-entrepreneurial ventures, it makes zero sense to me that you would remove the ability, the safety net, to be able to take entrepreneurial risks for people like me to go out on a limb and try something new and say, how many more people out there like me that are not going to start an entrepreneurial venture that would spur the economy? So this is an economic development issue as much as it is, and there's people that are, have much more serious concerns than that, quite frankly, in this room. But to me, it's just a no-brainer.
And now I'd like to introduce Sue Ruff from the Southern Tier Independent Center.
Thank you all for coming here tonight. Thank you very much. look around you. Nobody would come here unless healthcare was something that you felt pretty strongly about, right?
Right.
Okay. They asked me to talk a little bit about the ACA and people with disabilities. The ACA prohibited discrimination against people with pre-existing conditions, so that has been brought up, but I want to expand on it just a little bit. Anybody here know someone who has asthma, allergies, cancer, arthritis?
Yes.
There's probably not a person here who either does not have a pre-existing condition or does not have a family member with a pre-existing condition. And I'd like to kind of go backwards and remind people, if you have a permanent disability, you have a pre-existing condition, diabetes, depression. Before the ACA, insurance companies could decide to not sell insurance to people who had pre-existing conditions, or they might cover some conditions, just not yours. Or the premiums could be so high you couldn't afford them, or there was a cap. Remember the cap? On how much coverage you could get over a year or over a lifetime. That's fine if the cost of insurance is affordable, and it isn't. And that's the area that we would really like to see addressed. The subsidies and the mandates under the Affordable Care Act brought the cost of insurance down if you had disabilities. In the past, there was a huge disincentive if you had a disability to get a job because you'd lose Medicaid, which you absolutely might need just to survive. In the last, in 2007, when George Bush was the president, there was a program established called Money Follows the Person. And the Affordable Care Act extended that program. That was a program that helped people leave expensive government-funded nursing facilities and institutions, and it helped people live in their own homes with much less costly home care support. Now, the independent living centers across New York State have been working through the Money Follows the Person program for a long time. And in the last 15 years, the independent living centers have saved New York State $2.194 billion. Billion with a B, not million, but $1 billion by helping people stay in their own homes or helping people get out of the nursing facility and back in their own homes. That's a lot of money, right? Even for New York State. I'm glad to see everybody here today, and I think writing Congresswoman Tenney well, she was an assemblyman, but Congresswoman Tenney is a really important thing to do. And I would strongly encourage you to continue to advocate not only for yourself, but for your neighbors. Thank you.
You want to ask people if they have any comments or questions or anything?
Sure. Any other experiences that people would like to talk about?
And so his entire life has been dealing with medications and the after effects of having had diabetes all these years. Currently, right now, if we had to pay out of pocket for his medications, it would cost us over $3,000 a month between all the insulin and he's 30 years old, he has high blood pressure, high cholesterol, diabetic neuropathy, everything that goes along with the disease. For a number of years, I had my own business, and being self-employed, I did not have health insurance, but I was able to get my children on Medicaid. And so he's been covered with that. And now, because he wants to make something out of his life and have a full-time job, he's working for a small independent entrepreneurial business, doing web design, but without the ACA because his company obviously is a small business, doesn't offer health insurance like a big business does. If something happens to the ACA, I mean, I'm already talking to him about leaving his current occupation to go somewhere, a big business where he'll have health insurance, because we don't know what's gonna happen, you know, and he can't not be covered because he would die without his insulin on a daily basis. He has to check his blood 6 times a day. He has to have 4 shots of 2 different kinds of medications 4 times a day. You know, if anybody's ever had a child who's had type 1 diabetes, you know what it's like. It's every day, you know, every minute of the day. It's what do you eat, what do you don't eat. You know, it's a crapshoot too with the drugs, but without Medicaid help and without him being able to get his own insurance working for a small business, he definitely, obviously, would die. So it's a scary thing for everybody, but certainly for a parent.
My name is Marion Irwin, and I'm 61. My husband's 62, and he worked, for 20 years in the corporate world. But he worked for 10 years for one company, and was laid off. And then he was 2 years later, he got a job, another 10 years, and then he was laid off. And then he was unemployed for 5 years during the economic downturn. And we had 2 kids in college. We got through all that, and then he got a freelance job a couple of years ago, which was kind of a miracle, actually. I thought, because I thought he might never be employed again. And then that came to an end a year ago. And he had diverticulitis, pre-existing condition. Finally, after 10 years of trying to coexist with it, he finally had surgery last year, thanks to the Affordable Care Act. And this is not uncommon for people of our age, that we no longer have jobs that are going to supply us with insurance, because I think corporations have decided that that's not worth it to them. I think 61% of people now have insurance through their employment. And then that leaves us 40% of people who are trying to work, trying to have lives, and still need insurance. It's not the same, the business model has changed. And I think that, for our representative to represent us, she has to see the changing world that we're in and make sure that people who are still able to work but not able to get benefits to their office can still do that. Thanks.
I had a brother-in-law with a pre-existing condition, polio. Had it when he was a child. And he had a wonderful career, made a lot of money, but the polio comes back. And in his case, I won't tell his entire story, but he lost his home, he lost his business, and his family went bankrupt because of the medical bills. So we see in case after case after case, medical insecurity results in impoverishment. Medical insecurity results in premature death. And I think it's again, this is your meeting, and everybody in here has a story, or has a family member, or has a friend that they know would be at risk if they lost their medical care. Medicaid, by the way, has been life-saving for many people in New York State. It has also been the program that opened freedom for a lot of people so they could stay at home or could return home. And we worry about what's going to happen with Medicaid if there's a block grant. We wonder what will happen with Medicare if you're given a voucher and you can't find a doctor or you can't find a health insurance that will work within the voucher that you have or that you're given. So, any other comments?
I have a question.
Sure. Let me see if I can.
My question is how is the trickle down of losing the ACA going to affect a town like this, where we're dependent on hospitals? We're talking more and more about the fact that if people lose their coverage, they're gonna have to go to the emergency room. But on the other side of that, are the emergency rooms and the hospitals gonna be there
Right.
to serve us?
I thought that too. Are they gonna turn you away?
Well, that's a really good question. That may be one of the questions on your pieces of paper that you would like to write for Congresswoman Tenney. What happens to the hospitals?
Because they're turning away people now.
Right
My
now.
understanding is they're turning away people now because they have the option to get ACA, Affordable Care Act insurance. So once, they'll just turn everybody away.
Hospitals in New York State, they're going to lose billions of dollars with Medicaid. Our hospitals get what we call disproportionate share money because we have so many large number of uninsured folks. It's going to be a disaster for particularly urban center hospitals and our rural hospitals. The hits that we're going to be taking with Medicaid, the combination of people without ACA, it's going to be devastating the hospitals. And the hospitals are already meeting quietly with our Congress people to share their strong fears. And if our hospitals are affected so severely, it's going to affect all of our quality of care. And so this ACA repeal affects all of us. And I think if you read on the back of your blue sheet, you'll find some reason why this affects you or a member of your family. And the hospitals is certainly one place.
Okay, because I want to tell her, she's going to see this tape, that I'm pissed because I have called and called and called, got no answers. I've emailed 4, 5, 6 times, I get no answers. She needs to come here, she needs to talk to us because it's ridiculous. And she's coming up for election very soon and she's not going to get reelected if she doesn't start to listen. And on a different topic other than healthcare, I'm really incredibly concerned about all the blatant and obvious conflicts of interest that our president has due to his extensive business entanglements, which he promised to divest himself from and then just didn't. So that apparently Representative Bill Pasquale is circulating a letter to try and build support for an action because the Congress can act unilaterally to get Trump to release his tax returns, and I want to know if she's going to sign it so we can finally know if he's working for the country or on his own behalf, because just trust me doesn't work anymore.
My name is Isolde Trapper, and I don't want to leave the ACA behind totally, but I'm wondering if we shouldn't be fighting for health care for all. A single payer system, Medicare. We want to lower our costs, our health costs, or health care costs. And the way to do that is to have a lot of people in the pot. And that is what the ACA originally was going to be doing, except that so many states were able to opt out and not contribute, and so there are problems with ACA. However, if everybody was covered, they could eliminate health insurance companies. I feel bad for anybody here that works for a health insurance company, but you know, all the paperwork and all of the profits that they make, that could be eliminated, health insurance or health care would come down, and it would be affordable and everybody could be covered.
Yeah.
My name's Bridget, and I have a message for Representative Tenney. Representative, I'm not paid to be in this room. Not paid to be in this room? You know who is paid to be in this room, Representative? Claudia Tenney. You are paid to be here. Why are you not here?
My dear Congresswoman,
You know, I work with local government a lot, and I'm a pretty middle-of-the-road guy. You know, I grew up a Democrat, but I work with Republicans on a daily basis. I work very closely with them. I think a lot of them do a really great job. And I gotta tell you, speaking as somebody who leans more independent, the fact that my congresswoman went on television and said that our district was in favor of losing our health care, that I was paid to object to that, and then she refused to meet with me and the people in this room because she said it wasn't safe. And now she's doing a tour of Iraq and Afghanistan, but she didn't think it was safe to come and meet with the people in this room, her constituents. Speaking of somebody who is basically an independent at this point, I'm going to tell every one of my friends, come 2018, my independent friends, that if they think they're getting representation in Congress, they are kidding themselves. And the idea that she thinks she's going to be reelected when she refuses to meet with well-meaning constituents that are just trying to save their health care, she should be embarrassed, she should be ashamed, and she should realize it's over a month in.
I would like to make one comment that the problem is not the Affordable Care Act, and the problem is not the insurance companies. The problem is we want a solution for health care for everybody, on one way or the other. We're not going to reach it if we're attacking one side and defending another. The only solution will be a resolution solution that Congressman Tenney and her colleagues get together and realize there is a problem. Let's address the problem and not attack each other in Congress. It goes with health care, it goes with all other issues in politics today. We have to resolve to recognize the problem. And the problem is not one side or the other. The problem is we're not looking for the solution. We're only attacking.
Hi, my name is Angela. I have always worked in the field of people with disabilities. It's always been my focus. Okay, this is good? Yeah. Okay. My primary focus my entire life has been with people with disabilities. Getting services through Medicaid, home community-based labor services, has allowed many of my people to live independently. 2 years ago, I gave birth to a child who has medical conditions, and I never realized what it was like to be a parent of a child with a special need. And he, in the first 2 weeks, we put him on Child Health Plus, but Child Health Plus doesn't take effect until the first month, or the first day of the next month. He was put in the hospital after the first week of life, and we racked over $30,000 in medical bills. Because of his disability, his medical need, we were able to reverse it and go back to the day that he was born so that we didn't have such excessive medical bills. And this, if ACA is gone, that's a great possibility that a lot of families will be focusing on more medical bills for their infants. So I just think it's a really, really important factor to realize.
What do am I radiating electricity?
You're gonna hold it close to your mouth.
Close to my mouth, okay. I really was telling myself, no, sit down, shut up, don't, you know. But you people are too honest. We have heard terrible things, and that was the worst. A child in the first month of life, $30,000 to her parents. I'm going to tell you, the gentleman in the front said, we have to have a solution. Well, you have to deal with the problem. You know what the problem is? It's called capitalism. Yes. That's what the problem is. I'm not a wild-eyed radical. I don't love Che Guevara. Let's get me right off the bat. But there was an old guy out there with white hair You know, remember him, Bernie? He got all the kids going. And when they didn't get Bernie, they didn't vote. They stayed home. And a lot of the black people stayed home. And that sort of thing, you know.
When I was a child, long time ago, in the 50s, we had a congressman, his name was Edwin Arthur Hall. How many remember that name? The problem is nobody remembers, so I have to tell you a story about that time. He was not a good congressman. The details of which I don't remember because I was less than 10, but I know the family conversations. And what liberals did in the 50s is they all changed party. They registered Republican, they beat him in the primary, and they stayed loyal to the Republican Party. Sometimes, if your heart is in the right place, don't matter what party you're in, because the way to make a difference is to get rid of bad guys. That goes against a lot of people's grain. They're not going to change. But you can re-register after that election any way you want. I give you something to think about.
This is again to Claudia Tenney, and if you look at the district that you represent, who do you represent? It's an aging group of people, it's not a wealthy district, and what do we need is health care. And if the ACA isn't there, it's going to impoverish the community even further. There'll be less money for development, there'll be less money to anybody to go take a chance on anything good going on in this economy. And the other thing is that if it goes to the states, which is the other option that they're talking about, and having every state do it, it's going to put New York State in a terrible condition. We also have an aging state population to a large degree outside the city. This is not going to help your district. That's all I want to say.
Our family's health insurance premiums were always very high and always ever increasing, which was perfectly legal before the passing of the ACA, as we've heard before. These pre-existing conditions necessitated multiple spinal and hip surgeries in my 20s and 30s, including a spinal fusion and a damaging procedure called chemonucleolysis, causing spinal epidural hemorrhaging and scarring. As a result, I ended up using a wheelchair for ongoing pain management when we couldn't afford the high out-of-pocket cost for home health aides. Consequently, my ability to work outside the home was also greatly affected. We also needed this costly health care coverage for our daughter, who suffered a concussion from a serious bicycle accident and has severe asthma, in order to pay for daily nebulizer treatments and rescue inhalers, which without insurance would have cost over $2,100 per month. In total, the prescription cost alone for our entire family would have exceeded $5,000 per month. Our daughter has greatly benefited from the ACA by being able to stay on her father's plan until her 26th birthday while still attending college, as we've heard from many of you tonight. Many young adults across the state and country have also benefited. By 2013, our monthly premiums cost over $1,600, which was often over 50% of our monthly income, as my husband was already reducing his workload for both my care and that of his elderly parents. As we were heading closer and closer to medical bankruptcy due to our ever-increasing premiums, co-pays, and deductibles, the ACA was passed and monthly premiums for our family were reduced to $400, a monthly savings of over $1,200. On the New York State Marketplace's Silver Plan, my family receives tax subsidies to help with both our premiums and out-of-pocket costs. Yes, we personally have seen monthly premium increases in the past 2.5 years by the insurance companies that cover the southern tier, but at least these are now capped, as we've also heard here tonight, and haven't been rising by 10% a year, as when there were no caps on rising premiums for the sick. And under the ACA, insurance can't deny coverage or increase rates just because you have a pre-existing condition. My family and I did not lose our home in order to continue paying for our health care, but many families did. Although I am now on Medicare, this is a program that still benefits members of my family. If the ACA is cut, those of us on Medicare will also be affected. Seniors and disabled individuals will lose thousands of dollars per year on increases and/or additions in cost. These cuts will hurt our local economy and community by affecting all ACA, Medicare, and Medicaid recipients, hospitals, physicians, nursing homes, and more. 6 in 10 uninsured Americans can get covered for $100 or less a month, and over 20,000 individuals in Broome County depend on the ACA. So in conclusion, I have to say this: Social Security began as one of FDR's New Deal programs and evolved over the decades to become what it is today. I think that we can do the same with the ACA. So let's keep what we already have and improve, amend, or expand it with compassionate, humane, bipartisan support from all of our legislators.
Claudia, and this is to keep it short but honest, if we don't have health insurance, people cannot get their flu shots. In September, you will see nationwide, county-wide, nationwide, people dying off from influenza if they can't get the flu shot in time. So that's something to consider too.
And I'm just wondering for Representative Tenney, if it is the case that this is such a fearsome place to be, I don't find it all that frightening. I want to just share something that I found tremendously frightening this November after the election. Just seeing the result and seeing it repeal Obamacare taken as far as it has been, that looms on my horizon as a very serious possibility that I personally lose my Medicaid, which I have because Medicaid was expanded under the ACA. And I have bipolar depression. It hit me about 3 years ago. I was able to get treatment because of Obamacare, because I was covered under the up to 26 provision, and then with the expanded Medicaid. It takes 4 daily medications and twice a month therapy sessions to remain this functional. And I remember what it was like before being on treatment, and that is a tremendously frightening thing to potentially return to. And it's always the case that removing yourself from medication is sometimes even worse than having never started it before. Dropping medications all of a sudden can be traumatic. So seeing this possibility on the horizon of no longer having health insurance, of having to stop my treatment, that just sent my mind into just a spiral. It could truly end up being a downward spiral into depths that I have never seen before. It could end with an attempt on my life. I have no idea at this point. It's a scary thing to have to think about, and it's scary to feel yourself becoming just a pawn in a political game that's going on. These are our lives that are in danger, so please don't take our fear lightly.
I just want to ask Ms. Tenney where the proof is that there were paid protesters, that she was expecting to be here. A lot of things get said. People are giving you a lot of information and facts. I think we deserve the same, to hear the proof of the things that she says and to find a way to invite people to be part of her representation. Because, boy, I don't feel invited.
one thing I want to say from Miss Tenney is that I am Miss Health Advocate of New York State, and she does not have my vote for November.
I'll make this quick. In reference to the woman that just spoke over here, first of all, you're not alone in the whole spiral thing. And whether we're bipolar or not, we're all emotionally ill right now, at least the Democrats or the liberals are. So, but that's not why I stood up. Mental health is very close to my heart. I was a mental health veteran for many years, and I have a bipolar son. And yes, they're on very expensive medications, but they're functional. A lot. When I started out in the 70s, up the psych center, it was huge. It's reduced to 1 unit now. Those people are living out in the communities. They're all off their meds. Just imagine that. You know, just how you feel. You hit the bottom. That's what happens. And then they're going to be part of the community. Where am I speaking to Claudia Tenney? Just anywhere? Yeah, you know, I mean, so how is that good for the community? How is that good for the world? That's not just New York State. So, I just wanted to share that.
Hi, my name is John. I'm going to change it just a little bit. You know, Claudia, if you don't like working in the kitchen, you're afraid you're hurt or burnt, then get the hell out of the kitchen and resign now. You know, we're the richest country in the world, and why is it we don't have national health care? And yes, we're the poorest countries in the world do have it. What an embarrassment we are when we go visit those countries. Thank you.
I learned in a workshop many years ago something that has stayed with me ever since. Never go to a meeting and don't say anything. Don't have something to say. And this gentleman back here talked about being humans. That was very important to hear. We're all in this together. The human race is the center of creation. And we're all one. We have come from different backgrounds, but we're all heading on the same pilgrim journey here on earth and we should all be living together as one. And if we don't care about some people, we better get doing it pretty quickly. That's what, if we all remember, we're all part of the human race. We share that same background. So let's make sure that people learn that they have to contribute to the whole human race. For some people, it's going to cost more in taxes, probably. But those are the people that don't have to worry about it. Some people could pay more taxes, and some people could probably be paying less taxes, and we'll all even it up as we are one human race on the march to our fulfillment, whatever you might happen to believe that fulfillment is going to be.
Amen, Father.
Now I think we're going to talk about what we can do. Does that make sense? Because we need to do a lot of things, and I think one of the first things is we want to send a message to Claudia Tenney. We want to say, we have this empty seat up here. Where is Claudia Tenney?
Where is Claudia Tenney?
Where is Claudia Tenney?
Where is Claudia Tenney?
Where is Claudia Tenney? Where the hell is Claudia Tenney?
Where is Claudia Tenney?
Where is Claudia Tenney? Where is Claudia Tenney? Where is Claudia Tenney? Where is Claudia Tenney? Where is Claudia Tenney? Where is Claudia Tenney?
She's figuring out how to spend a lot more money bombing other countries.
Yeah, she's off to visit land of terrorism because she's afraid to be here in our midst to hear from the stories we heard tonight are just heart-wrenching.
And there's, 20,000 of them here in Boone County. And we need to tell Claudia Tenney, it is not acceptable that she dodged. There's over 100 people in this room tonight. And she refused to even come, and she refused to send a staff person with 102 people. So I want a show of hands, and I want someone to get a picture of how many people were paid to be here tonight. How many people are having no money and you came on your own time and of your own free will? All right, we want to send that picture to Claudia Tenney, that not one person in this audience is paid to be here. And she shouldn't be afraid of that. So, yes? All right. So, we need to communicate this to Claudia Tenney. We're going to show pictures, tell our stories, send our stories, but we really need people to do one thing. I mean, actually many things. But this week, why it's so important, and we see Congress people having town halls all around us. Tom Reed was just out there and held 4 town halls over the weekend. He was out there talking to his constituents. Mr. Katko is up holding town halls north of us. The only district that town halls aren't happening is in our district, and that's unacceptable. So, the first thing I need everyone to promise is to call Claudia Tenney and you tell her you were here tonight and that you need her that you're astounded, you're disappointed, you're shocked that she was not here. So we need people, how many will promise to call Claudia tomorrow and tell her what you heard and tell her she should be here and share with her. The other thing we're asking people to do is visit Claudia Tenney's office. I have clipboards and we're trying to get people to commit to stopping by her office at least once a week. So we have Wednesday, Thursday, Friday. We want people to sign up or just go and do it, but we'd like to make sure that people are going to stop by Claudia's office. How many will stop by tomorrow on Wednesday? What are the hours? 9 to 5. She is at the Metro Center. Free parking at Boscov's. You can walk over, and she's in Suite 210.
Every day?
Every day, 9 to 5. What? Not she. Her staff. Yeah, she's not there, of course. Sorry, I don't mean to throw you off. But she needs to hear from us. So how many will go on Wednesday? All right. How many will go on Thursday? Come on, we need more people dropping by Thursday.
Going around.
All right. How about Friday? All right, Friday's our big day. All right. We need people to do that, and we need to get you, bring a friend. Drop by your office, tell her you were here, make sure she, hears you, and you can stop by every week, bring a different friend. But we want her office constantly called and stopped by. We need Claudia to hear from us. The other thing that I think is very important is, and I'm going to spend a few minutes to give people time to write a little note to Claudia. I'd like everyone, there's paper on the ends of your table, and there's tons of pens. We can get you a pen. But I would like people to just take, and none of this needs to be pretty. It's a county game. If you misspell a word, that's okay. The most important thing is to send a message to Claudia. So I'm going to give everyone a few minutes to sit down and write a little note to Claudia. Take a minute. Just who needs a pen? We can get the pens. We've got lots of pens. I promise one to Anyone need a pen? Pen? Okay.
take them, because we're gonna collect these and give these to Claudia. Tell her what you think of her.
Absolutely. Do you need a pen?
The other thing, I'll keep talking while you're writing. The other thing that I think is really important, that we write letters to the editor. The address and how you write the letters to the editor is right here. They have to be under 200 words. But we really need, is there anyone in this room who will commit to writing a letter to an editor? We've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Will you write the letter by the end of the month, the end of the week? You need to tell people what you heard, how you heard it, and what's going on. So we have 10 people who are committed to writing letters to the editor. Okay, that's good. The other thing is this is an ongoing effort. Healthcare is just the first segue of attacks on our progress that we've made over the last 40 years. We're going to need to be fighting at every moment. So I would urge people to look at your blue sheet. We have an ongoing resistance meeting. It meets the first Wednesday of every month. We're going to be meeting March 1st. And we also have an ongoing kind of federal issues healthcare meeting every Thursday at Citizen Action. It's a noon time, and it's a time where we have a potluck lunch, so people can bring anything and come to the potluck and come to that. But people are welcome to come on Thursdays. But that's the March 1st. The March 1st resistance meeting is the first Wednesday, and that's on your blue sheet.